Rien say sami beshune sama kaldem ci fama dogi wo Rien say sama kaldem ci nit ñu baax ñamu sétalo Il mono fatte chi la yatalon chi la mayo on non jamais namanale 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 manu yok ye Rien say sami beshune sama kaldem ci fama dogi wo Rien say sama kaldem ci nit ñu baax ñamu sétalo Il mono fatte chi la yatalon on non jamais Namanale Manu yok ye Rien say sami beshune sama kaldem ci fama dogi wo Rien say sama kaldem ci nit ñu baax ñamu sétalo Il mono fatte chi la yatalon chi la mayo on non jamais namanale 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 manu yok ye Rien say sami beshune sama kaldem ci fama dogi wo Rien say sama kaldem ci nit ñu baax ñamu sétalo Il mono fatte chi la yatalon chi la mayo on non jamais namanale 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 Manu yok ye Rien say sami beshune sama kaldem ci fama dogi wo Rien say sama kaldem ci nit ñu baax ñamu sétalo Il mono fatte chi la yatalon chi la mayo on non jamais namanale 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 Manu yok ye fama do Yeboah. Yen say sama xel dem ci nit ñu baax ñamu seetaloon. Ngir mënoo fàtte ki la yaataloon.
All right. Good afternoon and good evening to all of you joining us from across Africa and beyond. Wherever you are connecting from, West, East, Southern, Central, or North Africa. We are delighted to welcome you this morning to this webinar. I think currently we have about a little over 20 participants. We'll start. I think along the line, the rest of the participants can join, so we are within time. All right, so my name is Roger Lawrence, and I have the pleasure of serving as your facilitator for today's important session. On behalf of AFREhealth, I extend our warm appreciation to every participant who has made time to be here. So today's webinar marks another significant step in our ongoing efforts to strengthen health professions education across the continent through collaboration, innovation, and more importantly, on digital transformation. So this session introduces an exciting partnership between AFREhealth and ScholarRx, which is mainly focused on developing and sharing high-quality open educational resources, that is OER, and then strengthening faculty development and expanding access to collaborative digital learning opportunities. We're also pleased to share insights about the upcoming capacity building initiatives, a new grants program designed to support AFREhealth's members and member institutions. So whilst we wait for others to join, and also to work within time, without further ado, let me first, before I introduce the speakers, let me first give a few housekeeping rules. First, we'll entreat everybody to keep their microphones muted during the presentations. We'll have two speakers speak. After that, we'll have a Q&A session, that is a question and answer session, where we'll allocate about 10 to 15 minutes. So if you have any question, you can write it down, you can note it down. During the Q&A, you can raise your hand using the Zoom hand raising feature, and then I'll call your name out to ask the question where the speakers will address or respond to it. In a case where you cannot speak, you can also use the chat box, and then I'll read it out for the speakers to also address it. Please also note that this webinar is recorded, and so after we are done, it will be published on our website and will be sent via your emails as well. All right, so let me introduce the first speaker so we do not waste much time. We have about 45 or 55 minutes to go. So first, let me say it is my pleasure to introduce Mrs. Georgina Yeboah, who is Executive Director of AFREhealth. Mrs. Georgina Yeboah is a visionary leader who continues to spearhead strategic collaboration aimed at elevating health professions education, research, and service delivery across Africa. In this session, Mrs. Georgina Yeboah will provide an overview of AFREhealth and also touch on the AFREhealth ScholarRx partnership and highlight the opportunities available to our members as we expand our work in digital learning and open education. So please join me in welcoming Mrs. Georgina Yeboah to deliver her presentation on AFREhealth partnership and opportunities for members. Mrs. Georgina Yeboah, the floor is yours.
Thank you very much, Roger. And I want to say a good afternoon from Ghana, good evening to the rest, and then for Tao, if you are in the US, it's good morning to you. And we're very grateful to all of you for showing up for this wonderful opportunity. My time is very short, and so as I start, I want to just give a brief about our organization, AFREhealth. So I know that there might be new people on board. That is why I decided to just give a brief of this organization, which is 9 years old, will be 10 years next year, August. And this organization is a Pan-African interprofessional network, so which means that we bring together all health workers. And I must say that for some time now, we are bringing together other people who are not health professionals, but who work also in the health space, whose work also help us to really improve the quality of healthcare in Africa through research, education, and capacity building. And we don't just bring people together, but we also ensure that there is the South-to-South collaboration among ourselves as Africans, how we can really work together, support each other, because we have strengths in certain areas, others have weaknesses, but we can come together and then work together to improve the lot of our people on the continent. In our work, as you saw in my slide 1, you saw health professions education. It is one of the areas that we work in. And in that area, as part of our mission statement, we look at transformation of responsive health professions education. The environment that we live in, or the globe, there are changes every now and then, and therefore the way we train our health professionals should also respond to the changes on the globe or on our continent. And so we look at how we can really transform that. And we look at it this way that, as we say in Africa, we want to go far. And if you want to go far, you don't go alone, you go with others. And so in going with others, we look at partnership and collaboration, which is one of the areas of our focus. And this has led us to our relationship with ScholarRx in this area, which he will be doing more details on that. So we started our discussions in 2024 when we met at the CUGH conference, and we continued with our discussions this year, and we firmed it up in May with a memorandum of understanding, which is lasting for 2 years. And it's a partnership born from a shared vision to promote equitable access to educational learning materials and health professions education. And then we also look at how, as Africans, we can develop our own digital solutions for our health education, not only what others have built, because we believe that we know our context and we should be able to do things within our context. What are the goals that we have in this partnership? We're looking at how we can improve access to quality educational resources for our faculties and for our learners, how we can empower our faculties when it comes to digital pedagogy and open education resources, and then also collaborations. You are not doing it alone, but you collaborate with others to co-create your own content that really meets your need, and then also share that what you are able to develop with global actors, so that people know that this is what we are also doing in our institutions in Africa. What are the opportunities for our members as AFREhealth? You need to be a member of AFREhealth and in good standing to be able to benefit from this opportunity that we've gone to seek for you. Faculty development workshops will be rolled out, and then also there will be small grants. Roger mentioned that, and Tao would also give details about that. So there will be small grants to support faculty in developing their own content. Then our members, that's from both individual institutions, can also have the opportunity to apply for the Medical Education Research and Innovation Challenge, which is another opportunity that ScholarRx offers. You have access to ScholarRx open education resource platforms and tools. There will be networking, as I've said, among ourselves as African faculty, and then also other global educators. And then selected AFREhealth members can also have the opportunity to attend the semi-annual ScholarRx meeting where you can showcase the work that you've done. Just recently, we had the opportunity to be in a meeting where others showcase their work, and you can also showcase yours. So for the next steps, we're looking at early next year, launching our capacity building sessions, and then also releasing the guidelines for the ScholarRx and AFREhealth grant scheme that people can also apply for. So all these things will be done next year. So you watch out for that. We'll share it with the community and then our regional chapter platforms as well. Thank you very much. And I hand over to you, Roger.
Thank you very much, Mrs. Georgina Yeboah, the Executive Director for AFREhealth. So we now move to our second speaker of the day, who is in the person of Dr. Tawali. So please kindly stay muted as I introduce the second speaker. All right, so Dr. Tawali is a leading figure in global medical education, widely known for his contributions to evidence-based learning and digital education innovation. He is the founder of ScholarRx and a strong advocate for the expansion of OER, that is open education resources, and scalable learning solutions that meet the needs of institutions and learners globally. Dr. Lee will be speaking on open educational resources, collaborative digital learning, and the AFREhealth Grants Program. So please join me in welcoming Dr. Tawali. And Dr. Tawali, you may please proceed. The floor is yours.
Thank you very much, Roger, and thank you, Georgina, for both the warm introduction and also the context, of how and more importantly, why do we want to collaborate and why do we think we can go further together than alone, to quote the famous proverb. So I'm going to share my screen in just a second, and just Roger, can you confirm that the audience can see my slides?
Yes, it shows very well. Please proceed.
Okay, very wonderful. So again, it's an honor to be here, and it's an honor to have this partnership, with AFREhealth that we've that we've been thinking through and building over time. And I want to thank, members of, of the leadership in, not only Georgina and Roger, but also Dr. Kaguli Mawade, the immediate past president who worked very closely, I worked very closely with to help develop this, also with, Dr. Judy Canyola and Dr. Roy Mabuk. So, I want to acknowledge that again, this is all about going further together than doing it all by ourselves. So I'm going to take about 20, I know I have 35 minutes, but I'm going to try to take less time because I want to make sure that this is really about you, really about learning, about how can we collaborate together? What are the needs in the different parts, of Africa, both inside and also how Africa wants to work with others, and how can we facilitate, those collaborations so that we can really address the needs of Africa and where it can collaborate, with others. And so, I'll share some high level thoughts, some concepts about open access education called OER, and actually how AI can actually accelerate that. I'll show you how that's potentially done, and then and then do some demonstrations, but then mostly opening it back to you to let Georgina, Roger, Elsie, Judy, Roy, the entire AFREhealth leadership help, facilitate a discussion about how can we all work together. So, so this is my declaration. This is this presentation is open access under CCBY 4.0. I want to share that, and remind folks that our social mission is to build a healthier world together through accessible, sustainable health education for all. And you can see that the emphasis is on the word together, and that we have been around for quite a while. We work with over 100 institutions and organizations, including AFREhealth. We touch over 150,000 learners a year. They do 90 million pages of content in some of the digital, in the print publications that we've done. and also 70 million in our digital learning activities. And so, we have a very active and broad footprint across the entire world, across all 6 habitable continents of the world, in fact. So I'm going to ask, I think, what looks like a simple, but could really be a profound question, which is, why do we share? Why share, right? This is something that we're taught to do at a very early age. We tell our children, share your toys, share your snacks, share your candy, and so, the question is, if sharing is universally considered a good thing, why don't we do more of it, particularly as we become professionals? So as professional educators, which is my field, why don't we share our education, right? If that's such a good thing to do. Well, it turns out that sharing is harder than we think, but if we could figure out how to share equitably and inclusively, and in a way that that's justifiable, then we can do tremendous good. And that's something we wrote about in academic medicine, a proposal for a shared medical school curricular ecosystem, an invited commentary we published in academic medicine, several years ago, actually prior to the pandemic, where we noted that health profession education often occurs in silos, and there's minimum collaboration among schools or even countries, and that this has always been inefficient. We saw how profoundly inefficient it was during the pandemic, and we proposed that if we could create a global shared ecosystem, based on commonly accepted standards for core competencies, accreditation, and learning design, we could really democratize access to quality health education, promote IPE, address workforce shortages, globally, and really decentralize the teaching and learning process, so that the power and the opportunity to teach and learn is in the hands of the many and not just the few, particularly in high-income countries, right? So that was really the vision, and again, this is something that we've been carrying around, for many years. A lot of that is, to realize that vision, a lot of that depends on how we can innovate and implement OER. OER stands for Open Education Resources. People often think about it as open access education. So there are many terms for it, but the technical term that UNESCO advocates for is OER, and it's teaching and learning resources that are available either in the public domain or under an open license like Creative Commons. It's been around for many decades, so this is not a new concept. And again, we often know about it through other terms such as free open access medical education, shareable education, or just open access education. And if you do OER properly, according to UNESCO, it's not just reusing content, but it's also be able to retain it, revise it, remix it, and redistribute. So there's a whole range of things that you should theoretically be able to do with OER. And again, many of you are already aware of Creative Commons, which is the most prevalent legal licensing system that helps propagate OER. So you may have seen things like Wikipedia, where the Wikipedia articles are available under Creative Commons license CC BY-SA. There are other organizations like MedEd Portal from AAMC that makes it available under a CC BY license. So there's a certain range of licenses that are more amenable to OER, like CC BY, CBY-SA, versus things that are not OER. So anything where it's ND stands for non-derivative, that's not considered OER. But you could have other restrictions like non-commercial, share alike, which is if I improve that open access resource, then I pay that forward, and so that's considered OER. And so we have our own system that supports OER called BRICS, RX BRICS. And so again, it is a global shared curricular ecosystem platform. It allows educators to develop learning modules called bricks. So the idea of bricks is that it looks like Lego bricks, right? As you can see in my video here, right? And the idea is that if you build one brick, then you can share that brick with the community. And then if somebody else creates a brick, then you can connect the two bricks together, right? Just like Lego bricks, the toys that you and I maybe grew up with and maybe your children are playing with right now, right? So that's the whole idea, is to create these shareable, accessible, and then also modifiable, we call it cloning and editing. And I can show a little bit about that, OER bricks with multilingual support, so that it's not just for English-speaking nations, but Francophone nation, Lusophone nations, and also to support all the major African languages as well too. And so what has happened? So we launched this manifesto in 2018. We actually launched all the tools in an open access fashion about just 4 years ago. So it's not been very long, actually 3 years ago, 3 or 4 years ago. And already educators from around the world have created over 2,600 of those bricks that you just saw under a Creative Commons open license. Involves nearly 900 educators, 160 schools from all over the world, all continents, all both LMICs and HICs. And these open bricks have driven over 5 million learning sessions, which is huge, right? Because you think about, how in some ways how small the medical education space compared to higher education or K through 12. And what we're proud to also point out is that if you look at our top 10 countries that are publishing open access education into our platform, fully half of them are from the Global South LMIC. So you see Vietnam, Peru, Colombia, Rwanda, and Ghana, right? So these are not high resource nations, but they're all contributing to this. And they also get access to, the open education coming from high income countries such as the United States, Canada, Belgium, United Arab Emirates, and Hong Kong, and other places. And you can see that, in the spirit of going far together, we have focused on developing, strategic collaborations across the globe, right? Georgina has already talked about our novel, partnership that we just, signed into existence just several months ago. We already are working with University Global Health Equity in Rwanda. We are working with other global organizations like AMI, which is the world's largest health professions education organization, IAMSI, which is also a global organization, ANZAPI, which represents Australia and New Zealand, PAFANS, which represents South America, American Physiological Society, which is actually truly a global MD, PhD society of physiologists, and so forth. So this is truly a big tent, movement. And to add momentum to that, we recently signed an MOU with the WHO Academy, which is the learning and training arm for all of the WHO. And you'll be pleased to know that their primary efforts right now is really focused on Africa with open learning and with a particular emphasis on nursing and community healthcare workers, both in lifelong learning and also in pre-service learning as well too. So this is David Achorina, the executive director. He just retired. And then this is Dr. David Chirumbo, who is the WHO representative to Rwanda, where there is some initial discussions for potential collaboration. This is also a share that our platform is being used in all parts of the world. This is an example of 3 universities in Vietnam, Hanoi UMP, Thanh Nguyen, and Nam Dinh, that developed an entire course for midwifery, targeting actually midwives, nurses, and primary care physicians. And they just presented some data at their national meeting where they showed successful utilization by over 100 nurses, midwives, and primary care physicians, where they completed most of the learners were able to complete more than half of the bricks while while being engaged in a busy clinical primary care practice. And you can see, and this is where it gets really exciting, that they can create you can create the education in your own language. It doesn't have to be English. Here it's Vietnamese. It could be French. It could be Portuguese. It could be Swahili. It could be other languages. Almost any language, not just English. English does not have to be the default language, but then you can translate. That being said, it's just to show how global this is. This is an example of two very well resourced organizations, Harvard Medical School and Johns Hopkins, that are collaborating on creating clinical neurology educational platform for medical students. And they're doing it in such a way that now it's so successful that they're actually now branching this to their African counterparts and collaborators in both Ghana and Zambia. And so you can see that this is about critical thinking and clinical reasoning about how do you approach a patient who comes to you saying, hey, look, I have the worst headache of my life, or I feel dizzy. And so this is a module that was created at Harvard, but then peer reviewed at Hopkins. This is a module that was created by Hopkins and then peer reviewed by Harvard. And so you can see how they are trying to go further together than going by themselves. And now, we'll just spend a couple of minutes about AI and OER. So we think that AI, will be transformative for open access education. You already know about artificial intelligence. A lot of this was discussed at the AFREhealth conference in Dakar just 2 months ago. You're aware of obviously the various AI tools, including some of the open access tools out there, such as Llama and DeepSeek. And you are already aware that educators are starting to use AI quite a bit, for their learning and teaching. And this is the 4D framework from EDUCAUSE from the United States, where they categorize the major applications into dreaming, so brainstorming using AI for drudgery, so for low repetitive tasks that may be of less value but still very important, designing your own content, and then development, so professional development, faculty development, development of a learning organization, at your institution. So that's the 4D framework here, and with the the link, and then we are very pleased to introduce our own AI platform called TIE. TIE stands for Teaching with Artificial Intelligence. This, you can think about TIE as a teaching co-pilot, kind of a faculty co-pilot to support and help augment you. In other words, it helps you do whatever you do, but gives you superpowers to do it better, faster, and be more productive, so that it can handle some of the time-consuming work, and then allows you, including developing OER, but then allows you to frees you up to focus on higher order teaching activities and student engagement, like, for example, small group learning, where the students crave human contact and they don't want to be talking to a robot. They still want to talk to you, and so so the AI frees you up for that, but doing it in a responsible way with safety, privacy, and security guardrails, but do in a way that it's inclusive, so that there's equitable access to everyone, regardless of their financial situation. So this is actually what TIE looks like, and I'll do a demo in just a little bit here. But you can see it looks like a chat GPT, where you just basically tell us, look, I need to create a module on asthma. In fact, we'll do that as an example, for Rwanda or Nigeria, medical students or nurses or whatnot, and it can actually instantly develop education resources for you. From your slides, from your learning materials, from your school's curriculum, or even from other things like in this particular case, any PowerPoint, right? So you have a PowerPoint, for example, this talk that I give on OER and AI, you can see that I was able to convert it to a module. You can scan that QR code or whatever. We'll make these slides available to you later, and then you can take a look at the module. You can also take a journal article. This happens to be an open access article about cancer incidence, in childhood, in the association with childhood residents near a radioactive waste site in the United States. And this was the module that was created, from that open access journal article, or it could be a textbook article that's open access that you have access to. And so that's an example. Now, before I get into our grant program, which Georgina alluded to, I'm going to show you a little bit of the platform. Then we'll talk about what you can do on your own or with our grant program. So I'm going to switch screens. So I apologize for the transition here. Let me get to it. I think here it is. Okay, great. So this is an example of a brick. Well, first of all, I should show that you can. Sorry. Normally, where you would start is the brick exchange. So the brick exchange is completely open. This is a resource that you can have, and you can see that it has the bricks that I've gone to. You can see that it has access to bricks from other institutions. As I mentioned, 160 medical schools and other institutions and organizations have contributed, including like APHE, AHMG. This is very technical, right? This is the Associate Professors for Human and Medical Genetics. And you can see that this is what they built, molecular basis of cancer part 2, tumor suppressor genes. And you can see that this is very high quality education that they've developed, right? And you can see that, it's very interactive. There's opportunities to interact, learn, do flashcards, images and so forth. And you can see that, so this is just an example of something. Let's just say that you find this worthy, and you can see that these are all quality educators from, Kathy Hyland is the head of genetics at University of California, San Francisco, a top 5 institution in the United States. And if you like what they did, you can actually clone and modify it. And you can keep it in your language. Or let's say we were in Dakar, right? So we were in Senegal. That is a Francophone country. They, with a click, because this is open access, can clone and modify it. And within seconds, this will convert this module to a French version, as you can see. Traduit par machin, my French is terrible, but let's say this is for, and I'm making it up for University of Dakar. And you can see I can edit this directly. I can change anything about this. Maybe this is a person that's not that set on, but maybe 28 ans, right? So if we want to stick to French here, and you can add anything you want. You can add your own text. You can add your own images. You can add your own videos, and videos is just as easy as adding a URL link to maybe something that you found on YouTube that would be helpful to discuss tumor suppressor genes, right? And then when you're done, you can preview it, and you can see that it tracks all the versions. I am at perhaps again the University of Dakar. I'm going to publish this on behalf of the University of Dakar, but then it has direct attribution back to the Association of Professors for Human and Molecular Genetics in the United States. And so everybody gets their credit, right? I get credit for adapting it. The original author gets a citation, and then you can go to the original version if you want to see what happens. So this is the power of the community. And again, so obviously, AFREhealth can decide to build its own community, but AFREhealth can also tap into a global community of educators from all around the world that are freely sharing education with each other in these reusable, interoperable brick modules, right? So that's an example there. And I also want to share that there are, examples where, universities in Africa are doing. So this is UGHE. So they're building bricks on gluconeogenesis. And it's not just, university educators, but it's also the students as well, too. So we also have a relationship with FAMSA, and I think FAMSA has a relationship with AFREhealth. This is the Federation of Medical Student Associations. And you can see here that FAMSA has built their own library of modules here, right? These are all created by African medical students with African faculty reviewers. And so, for example, this is about preconception and family planning. These are the medical students from Africa, and these are the faculty that they engage to review with them. And so they talk about, how do you do family planning? How do you do this? But really with an Africa first approach, right? And so they created their own images. They created their own, questions and so forth. And all basically in a situation that, while it's contextualized to Africa, it can be used anywhere, around the world, right? And you can see that, they built quite a nice library of modules focusing on maternal fetal health, at least initially. But it could go in any, any direction, right? So yeah, here's a case of where they're focusing on a woman from northern Nigeria in this particular module. And again, at any time, if you like this, you can clone and modify this for your curriculum, whether you're at a nursing school, a medical school, a pharmacy school, or a public health school or a dental school in Africa. And then you can view the statistics and so forth. And then lastly, and again, lastly, I want to talk a little bit about AI. So everything you saw was built without AI. The students did this on their own with the faculty. Harvard built this on their own. UGHE built their own modules, and APHMG built it, using AI, without AI. But now AI can actually help with this. And so let me give you an example. Let's take a primary care situation, whether you're a primary care nurse or a primary care physician, family medicine, or maybe you're a public health worker. We all know that there are global guidelines for asthma, and they are updated every few years. These are the 2024 guidelines. And if you go scroll through it, you'll recognize that this is just the summary of the guidelines. And the summary of the guidelines is 50 pages. If you were to go to the actual core guidelines, is about 250 pages. It's quite a bit of material for educators to use. So let's actually create a module for those guidelines. So I'm going to ask you to help me guide the development of that. So I'm going to open up the chat, and I want to ask, who is our learning audience? So we can say, create a brick about, asthma diagnosis, and management for, according to the GINA 2024 guidelines. And you can see I've already uploaded it here. And by the way, you can upload the guidelines by just clicking on this thing or dragging and dropping the file in. But I've already did this ahead of time. But who's the audience? Give me an audience. Who do you want to teach? Doctors, nurses, medical students, nursing students? Are they in Nigeria? Are they in Rwanda? Are they in South Africa? Give me an idea. Can somebody type something in the chat? Nursing students. All right. Where are the nursing students? Okay. For nursing students. I need Northern Africa. Why don't we? Okay, I'll go to somebody. Let's go with Uganda. All right. So Dr. Nabuka says Rwanda. Is Busatima in Rwanda? Uganda? Sorry.
Uganda.
Okay. Why don't we just go with Uganda? All right. Let's do that. is Uganda an English-speaking country or a French-speaking? Is it Francophone, Lusophone, or Anglophone?
It's English.
It's English. Okay, so we'll
Yes.
keep it in English. But let's pretend that this was for Sierra Leone, for Senegal, right? Because I was just there, and I know it's a Francophone company, or Cameroon. So you could say, if I wanted to, I could say, please output brick in French language. I won't do that, but I could, right? But we'll keep it in English for now. Now, I'll also let you know that this could be a standard brick, or this could be a case-based brick, right? So for case-based, this could be you can use this for CBL, PBL, case-based learning, problem-based learning, modified PBL, TBL, because it's all about creating a whole case application. But we'll make it a standard brick right now just to keep it straightforward. And so I will now ask Ty to do this using the global GINA guidelines. This should take about 10 seconds, but what's going to happen is that it's going to it's going to break down and analyze the article, and then it should come back with learning objectives. Here it is, and you'll notice that it has Bloom's taxonomy learning objectives for define, describe, explain is level 2, then apply and evaluate are level 3, level 4. It has the GINA guidelines and so forth. Now we did tell it, we did say nursing students and so forth. And so, we could just say, but if we want to be specific and remind them, we say, hey, look, for patients, in Uganda, right? So we can edit it. We can, move things around if we want to. For patient, by nurses, right? So we can be more specific like that. And then, apply the guidelines, and then again, we could say for nurses, right? In Uganda, right? So we can be specific, and then, and if we wanted to, we can add more learning objectives. We won't. And now we're going to ask it to build the outline. So that's the next step. And then that takes about 20, 30 seconds. So be patient. Oh, well, this was actually fast. All right. So it came back with this scenario. AK is a 28-year-old woman, presents to the outpatient clinic in Kampala, Uganda. Dr. Nakata let me know if Kampala exists. I think it does. And has shortness of breath. What are the, there's a third-year nursing student who is on clinical placement in the same clinic, taking care of this patient. How should control be assessed? How should this be managed? And then you can go through this, and then you can see that it's talking about, the pathophysiology of asthma, symptoms and control, key diagnostic criteria. What is the diagnostic criteria in Ugandan clinics, right? So it's already picked up on that. What are the nursing strategies for monitoring control and so forth? So it's already incorporating all that and tailoring the GINA guidelines for Uganda nursing students, right? And then how do you do this? What are the, how do you, teach inhaler techniques to nurses in Uganda so they can teach that to their patients and so forth. And then once you do that, thank you, Dr. Nakazia. So you can see how specific this can actually get and how tailored you get. And then what you do is then you could then, if you edit it, you can edit it just like you edit the outline. I forgot to, I can move some stuff around. I can edit it. I can subtract and can say, oh, I want Uganda and Nigeria. I don't know, they're next to each other, but maybe they are. And so maybe the presentation is similar. Maybe they're both English patient. Maybe they share resources or whatever. Now what's going on is Ty is building this out. Now, just to be clear, Ty is not a single AI. Ty is actually a team of AIs. There's about 7 AIs working together right now that are building out this module. And so what I will do is I will go to another module that I built, because it's going to take several minutes and we don't have time here. But I'll go to a sorry, I'll go to a module that's already been built. So you go create brick, summon tie, and then I'll go to a module that I've already built here. Let's see, there should be something about asthma here. I know I did something about asthma recently. Where is it? It's funny. I just did something about asthma. Let me see if it might have actually already built it already. Let me see if I go back. Okay, it's still working on it. But here's something where I built something on. I did a talk on. Sorry. Whoops, that was a bit of a glitch. Sorry, I have too many screens that are open. Let me see. So once you once you have a module that's been built, you can this was about OER and nursing. Let's see. Okay, yeah, this was something that was already built. So this was basically, again, something I did about OER and medical education. You can see how it it has a first draft. This was built in about 3 minutes, and you can see that it built all the flashcards, all the assessments, and everything. And then you can actually tell Ty to do other things. So you're critiquing Ty as the senior author. You're the senior author, and Ty is the junior author. And then you can simply say, I want more examples, or I want this to be, give me more examples from Uganda, or something like that. So let's talk about provide examples of OER, from Africa, including, health, sorry, can't teach and higher ed. All right. And then, and then it can actually rewrite this and provide more context. And so it actually can pull up resources. You can see that it, Ty instantly will rewrite, with redline, and it'll tell you, okay, well, these are the things that I know about OER in Africa, like OER Africa. Here's the HEAT program with the UK and Ethiopia, Open UCT out of Cape Town, Kawame out of Ghana, and AVU. So there's obviously a number of things. And so you can see how Ty can do these things on the fly. And let's say, yep, here we did. Same thing here. Now we're back to this brick. This was created. And then you can say, hey, look, clinical manifestations, you can see how well it works. I can edit this as the senior. Again, I'm an asthma expert. I'm like, yeah, this looks good. This looks good. Asthma control, stepwise management and adjustment. Hey, let's do something, maybe I teach nurses and I say, you know what, this is a tricky area for my nurses that I train in Uganda. So I can say, please, expand with, examples, difficult examples for, difficult case examples. All right, let's just do that. Let's see what it'll do. And then it can again develop some scenarios. Okay, in this case, let's talk about a 14-year-old case. That how do you do this? How do you treat this? And you can see it comes up with, these are some difficult scenarios that nurses, the nursing students I may be training, have challenges with, and so they can read this, or we can discuss this and so forth. So and if we like it, then we can accept it. and then we can continue to critique the module like a research paper, including all the formative assessments. And then when you're done, you can then actually take this into the editor, and then you can say for University of, I can't remember the name of that university. Gosh, somebody gave me a university. It was Busatima. I think Busatima is in Uganda. So you see how this can go, and then you can get the preview and then share it with your curriculum committee for review right before you launch. So again, I probably took a little longer than I should have, but there's obviously a lot of power in this platform that AFREhealth members will have access to. So getting back to the the partnership, as mentioned, we want to ensure you have access to this, but also there's a competitive grant program that we're putting together that will allow institutional applicants to develop open health education curricula for Africa. We would provide a monetary grant, brick access for up to 200 students, access to our Thai platform, investigator training and support. And this is for AFREhealth members and institutions. We are working out all the details. You'll hear more from Georgina and Roger in the coming weeks. So all this will be shared. And then we also have what's called Brick Builder grants. And these are for individual educators and students who want to develop and share open access curriculum on our platform. And there are individual grants of $500 up to 5 for AFREhealth members. There's a 2026 application cycle that will start in April, and this is the link. But AFREhealth will supply that link again when the call for application starts. And again, we welcome both educator and students, but the students applicants will need to come with a faculty advisor reviewer. So again, to quote Georgina, we want to go, in a way, we do want to go fast, but we want to go together because we can go even faster together. We can go even further together, and AI can actually help that. And so we look forward to going on this journey with you. We're excited about the possibilities. And so this is my contact, and Farzan works with me as well too. The grants will again be governed by AFREhealth, and so obviously this is their contact. So with that, I'd be happy to open it up for questions. And I know we only have a few minutes, about 5 minutes left, but handing it back to you, Georgina and Roger.
Thank you so much, Dr. Tao. Thank you for that insightful presentation and the demonstration. It was very engaging, and I could see the comments coming. Looks like we want more, but time is not on our side. So let me know which time. Let me open the floor for any questions from the participants. If you have any question, please you can raise your hand or you can type it in the chat box, and then I will read it out so we can address it. If there's any question.
Yes, I do.
Okay, so I see a hand raised by Ntabi. Yes, please go ahead.
Yes, this is a great resource, but I just want to know how do we assess human contribution, because we are telling AI what we want to do for whom and whatever, and it searches and creates nice scenarios and stuff like that. But then if I were to assess either a faculty member or a student, what would I say that human contribution, their thinking, I don't know, I just to make sure it's there, it's original, but knowing how do I deal with that? Thank you.
Yes, so you can look at Thai as, again, just your co-faculty. You are still the senior faculty. You are in control. So you can accept as much or as little of what Thai suggests. So you saw how I was able to directly edit all those learning objectives. So for example, Thai is basically for me. I've done asthma care for 30 years, right? So I know asthma, right? But I don't want to do all the, I don't want to do all the grunt work, right? So I asked Ty to basically draft stuff, and then I go in and I'm really essentially the executive chef. I say yes, yes, no, no. I like this. I don't like this because I know what I want because I've done asthma for 30 years. And then I review everything. It'll be my name on the module. I'll supplement with my own references and so forth. And again, I provide Ty with my slides. So Ty is keying off of how I teach, and again, that's my expectation as an educator. Now, it should work with whether the educator is a senior or a junior educator, because at some point, most of us are comfortable, hopefully, in our clinical domains, whatever it is, whether it's primary care, reproductive, maternal fetal health, or whatnot. And so again, at the end of the day, you have complete control of Thai. You can accept as much or as little as Thai offers you, but it's your name on the module and your institution on the module too. So you get the last word in reviewing and correcting everything, and then your institution, whether it's I'm making it up, UGHE or or University of Uganda, has their own peer review committee. They can review it as well too. So at the end of the day, the humans have the last word. Hope that makes sense.
Thank you. Thank you.
I think we have maybe time for one more question.
Yes, there's a question also in the chat, says about the grants. What are the thematic areas? Could it be research or education?
So we are actively working out the themes with the AFREhealth leadership with Georgina. So there will be more details, but my expectation is that it will be focusing on African needs and themes and so forth. So I would defer to Georgina, Elsie, and Judy to answer that, and Roy.
Yes, now, as we've said, that is what we're going to do. So we'll be working with the skills development and training subcommittee to really come out with the areas. And I must also say that as in my presentation, I indicated there'll be training on this. So I think this is just, let's say something like a demo to whet your appetite. And so the training will also be done because you need to have the skills to be able to apply for the grant to build your own bricks as well.
Exactly. Okay. All right. Is there any more question? Any questions?
There was a question about Thai's availability. So let me be clear. We have a special partnership with AFREhealth to contextualize everything that we do for Africa. That's the but our expectation is Thai is available to everyone. We work in all countries. We work on all continents. But in Africa, in particular, it's our preference. I'm sorry. The partnership with AFREhealth is to help contextualize everything we do, to be able to address the African context. But that being said, we expect Thai to be available to everyone.
So, as we indicated, this is a partnership for AFREhealth members. We represent our members because, as we indicated, we are an interprofessional organization where we're a member-based organization. So we stand in for our members. So anything, our members will be the first to benefit. And so if you are not a member, we encourage you to join AFREhealth so that you can also benefit from what our members will be benefiting from.
Okay.
Great.
So looks like there are no further questions. Now, do you have any final words, or we can go ahead and give the
Well,
All right.
first of all, I want to thank everyone, for spending time with us. We're excited again with the collaboration and the partnership with AFREhealth and with Georgina and Roger and Elsie and Judy and Roy and other AFREhealth leaders. Anything with the grants, please reach out to AFREhealth. We can provide the technical support, and we will provide a copy of these slides afterwards, so Roger can distribute this to everyone that registered for the meeting. And again, we look forward to further announcements from AFREhealth, in the coming weeks with regards to the various grant opportunities to participate and to build shareable education together. Thank you very much.
Great.
So thank you, everyone. We appreciate your time. And Elsie, thanks so much. It's when you were in leadership that this partnership was started. And today we are seeing how far bringing it. And we know that our members will really benefit from them. And the continent will also be the beneficiary. Thanks, everyone. And Tao, thanks a lot. Roger, we are very grateful to you. Enjoy the rest of your day.
Thank you.
Bye-bye.
Thank you.
Thank
Bye-bye.
you.
Bye.
Bye.
Bye bye.